Diabetic foot ulcers are a common and potentially serious complication of diabetes mellitus. These ulcers are open wounds or sores that typically develop on the feet of individuals with diabetes. They are often slow to heal and can lead to severe complications if left untreated. Here's a detailed breakdown of diabetic foot ulcers. Causes: neuropathy. Prolonged high levels of glucose in the blood can damage nerves, a condition known as diabetic neuropathy. This neuropathy often affects the nerves in the feet, causing a loss of sensation or feeling. As a result, individuals may not notice injuries, cuts, or pressure points on their feet, leading to the development of ulcers. Peripheral vascular disease. Diabetes can also damage blood vessels, reducing blood flow to the extremities, including the feet. Poor blood circulation impairs the body's ability to deliver oxygen and nutrients to the tissues, slowing down wound healing and making it easier for ulcers to form. Foot deformities, conditions like bunions, hammer toes, or Charcot foot, a condition where the bones in the foot weaken and fracture, can create pressure points or abnormalities in the foot structure, increasing the risk of ulcers. Poor foot care. Neglecting proper foot hygiene, such as failing to wash and dry the feet thoroughly or not wearing appropriate footwear, can lead to skin breakdown and ulcer formation. Foot injuries. Even minor injuries like blisters, cuts, or ingrown toenails can become serious problems for diabetic individuals due to impaired wound healing and reduced sensation. Symptoms: diabetic foot ulcers may present as open sores, wounds, or areas of redness on the feet. They can be accompanied by pain, swelling, warmth, or drainage of pus or fluid. In some cases, there may be no noticeable symptoms initially due to neuropathy, making regular foot inspections crucial for early detection. Complications. If left untreated, diabetic foot ulcers can lead to serious complications, including infections, cellulitis, a bacterial skin infection, osteomyelitis, bone infection, and gangrene, tissue death. Severe infections can spread rapidly and may result in systemic complications such as sepsis, a life-threatening condition. Diagnosis. Diabetic foot ulcers are typically diagnosed through a physical examination of the feet by a healthcare professional. Imaging tests such as X-rays, MRI, or CT scans may be ordered to assess the extent of tissue damage or to rule out underlying bone infections. Treatment. Treatment of diabetic foot ulcers involves a multidisciplinary approach and may include debridement, removal of dead or infected tissue from the ulcer to promote healing, wound dressings, application of appropriate dressings to keep the wound clean and moist, offloading, reducing pressure on the affected area through the use of special footwear, casts, or orthotic devices. Antibiotics. Prescribing antibiotics to treat or prevent infections. Hyperbaric oxygen therapy, administering high-pressure oxygen to promote wound healing in severe cases. Prevention. Prevention of diabetic foot ulcers is crucial and involves maintaining optimal blood sugar levels through proper diabetes management. Daily foot inspections to check for any signs of injury or skin changes. Wearing well-fitting supportive footwear to reduce pressure on the feet. Practicing good foot hygiene, including washing and drying feet thoroughly and moisturizing dry skin. Avoiding going barefoot, especially in high-risk environments. Regular foot exams by a healthcare professional, especially for individuals with neuropathy or vascular disease. In conclusion, diabetic foot ulcers are serious complications of diabetes that require prompt diagnosis, treatment, and preventive measures to avoid complications and promote healing. Effective management of diabetes, along with proper foot care and regular medical monitoring, is essential for reducing the risk of developing diabetic foot ulcers and maintaining overall foot health.